Hey guys, and welcome back to my channel. I don't know if you guys can tell from the title, but this video is for the girls, for the women out there, not just my CKD patients who desire to get pregnant, but for any woman who desires to get pregnant. I have some very valuable information that I want to share. A lot of what I'm going to be saying today is information that I have cited from medical journals, medical researchers, kidney doctors. So all that will be in the description box below. So a lot of me will be reading because I want to make sure that I'm delivering this information correctly. It's super important to me. I got diagnosed at 21. I had my second transplant in 2021, and I had just crossed over the threshold of 30 into my 30s. I was extremely concerned about whether I would be able to have kids. This has been a very important space for me to really make sure that I'm doing my body correctly, because I do desire deeply to have a family, and I know that society puts such pressure on women in this space. But for me, it's something that I really want. I come from such a close-knit family, and I would love one day to be able to create my own. When it comes to kidney disease, it does increase the risk of pregnancy and the complications that come with that for both the mother and the fetus, including a higher chance of preterm birth, low birth weight, and preeclampsia. And then for those of you who want to know what preeclampsia is, it's a complication of pregnancy. Typically, you experience high blood pressure, high levels of protein in the urine, which kidney disease patients are very familiar with, but the proteinuria and other signs of organ damage. Protein in the urine is a sign of kidney disease. Preeclampsia usually begins after 20 weeks of pregnancy in women whose blood pressure had previously been in the standard range. But left untreated, preeclampsia can lead to fatal complications in both the mother and the baby. So when it comes to navigating your pregnancy as a CKD patient, planning is key. When it comes to kidney disease, early delivery of the baby is often recommended when you're dealing with preeclampsia. The timing of delivery depends on how severe the preeclampsia is and how many weeks pregnant you are. So like I said, the emphasis on planning is key. There's so many risks associated with it when you are dealing with preeclampsia when you have kidney disease. So just making sure that you do everything that you can. So when you are a CKD patient, getting specialized care is needed. It's sometimes in hospitals required, so you can't just go to a regular gynecologist. You have to go to MFM, which is maternal-fetal medicine, who does specialized care specifically for high-risk patients like kidney disease patients. So outside of preeclampsia, for kidney disease patients, it is highly common that you are going to have a C-section, almost 3 times more likely for a CKD patient than a normal pregnant patient. Another thing, there is a higher risk of acute kidney injury. If you are a transplant patient, you know how much we put our bodies through to even get the transplant, the process, the long time that you wait for this kidney, and then pregnancy could potentially put it at risk. That can be a cause for stress and worry. As I'll be speaking about later, is that there also is high chances for you to have a wonderful, risk-free pregnancy. The risk for the baby when you are a CKD patient is preterm birth, low birth weight, and in the most extreme cases, there is increased risk of pregnancy loss. So something I wanted to bring to people's attention, if you're not aware, if you're not doing the active research, if you're not somebody who's currently planning for a pregnancy, you may not know this, but one of our kidney anti-rejection medications, CellCept, mycophenolate, whichever one that you take, it has a negative cause on the fetus. This reads, the highest risk for the baby of a transplant recipient happen when a mother takes CellCept. There is both higher chance the mother will miscarry and a higher chance that the baby will have birth defects. So that medication in particular, it's almost non-negotiable to be able to take during your pregnancy process because of the damage that it does to the fetus. There are alternative medications that you can take as a CKD patient in place of the CellCept. I actually went to a maternal-fetal medicine doctor in Nashville at Vanderbilt where I received my kidney transplant. They suggested that I would switch these medications a year before I even started trying to get pregnant, just to make sure that my kidney graft would be okay with this medication while I endured pregnancy. There are alternative options, but you just have to make sure that you are pre-planning the birth. For me, there's nothing more important. Obviously, I have these deep desires to be a mother one day, but I do have to prioritize my life. That's first and foremost. And secondly, just because of my deep desires to be a mother, I don't want to bring a child into this world knowing that my body is going to inflict a lifelong set of issues on that baby, especially as somebody who deals with health issues. Like, I don't want that for my child. So I wanted to read this. This is more on the positive side. In women with chronic kidney disease, fertility is reduced due to hypothalamus pituitary ovarian axis dysfunction, which makes the chances of spontaneous pregnancy during dialysis very rare. So what you're going through with dialysis, that typically it's very hard to actually get pregnant on dialysis because of this. But it does say, so this is the positive side of it. After kidney transplantation, spontaneous fertility is generally restored in less than 6 months. After the first successful pregnancy of a CKD patient in 1958, pregnancy is not an exceptional event any longer in recipients of a kidney transplant. So basically when it says pregnancy is not an exceptional event, it means it's not a rare occasion. It's not something that doesn't happen often. Since 1958, ample CKD patients have been able to get pregnant and deliver their baby healthily. It says the number of pregnancies after organ transplant reported in international registries has been steadily increasing, with the rate of live births over 70%. Although these pregnancies are at a high risk, the rate has been steadily increasing. So I think with the increase of research and the increase of technology, it's becoming easier and easier and less of a risk for people who have already had their kidney transplant to have children. So that's a wonderful thing. I do want to say this part of it is extremely important. The current international recommendations stress that pregnancy in transplant recipients requires good planning. I think I've said that a few times in this video. Scientific societies recommend waiting at least 1 to 2 years after your transplant. And that's even after that transplant has good organ function. So after you have recovered from your transplant 1 to 2 years and you're looking at your numbers in your blood work and your doctors are saying everything is okay, making sure that the body has kind of fully recovered from that transplant and that surgery and that kidney has taken well to your body. So specifically, I told you guys I have dreamed of being a mother for many years, and with what has come with my body and all the things that I've experienced because of my kidney transplant, I got offered to do a study with LERA Health. LERA is a digital functional medicine company focused on women's health. It uses AI and personalized plans based on diagnostic testing to help women improve their overall health. They offer services for issues like hormonal imbalances, stress, and fertility. So I was invited to do a health study in March of this year with LERA, where they tested everything about my body, tested my blood, tested my saliva, tested my stool, tested my urine, did a vaginal microbiome test, just so they could really collect all the data surrounding me, my woman's health, my functional health, to see, okay, Dawn, what are you dealing with? If this is something you want for your future, how can we give you the best possible chance to achieve this? I've met with Lynn Dudley, who is the co-founder and medical director of LERA, the co-founder Jennifer Voss, and CEO. Jennifer is actually the CEO. We've had ample meetings. We do workshops once a month since I actually started this study, just so they give us so much information. Before they gave us all the tests, we actually did a 5-day detox that they sent us like such thorough information on how to prep our bodies for this test so that they could get the best results and like the most clear results for us, so then we can make the adjustments. And then after you get your results, you meet with Lynn. Lynn really discusses with you and breaks down what we have to do, what needs to be done, what these results are telling us about your body, and how we need to make a change to make sure that your body is functionally as healthy as possible. And although my kidney disease does have effects on my body, generally, Lynn has confirmed that my body is in actually a really good place. I've learned a lot of things about myself, about sensitivity, about my habits that I need to adjust, especially if I want to be a mother. I love the team at LERA. In addition to Lynn and Jennifer, they also set me up with a mindfulness coach. And they set me up with a general health coach that I meet with on a weekly basis. And we talk about everything, not just what's going on with my physical health, but what's going on with my mental health, what's going on in my life, how is that affecting my stress levels, which affect my cortisol levels, which affect my ability to be pregnant, and things of that nature in so many different realms. And I'm just so grateful to be a part of this. I actually have recently gotten some new blood work, some updated blood work that Lynn has ordered, and I just got the results in a couple of days ago, so I am about to meet with her, and I want to share this call with you just to show you how thorough our communication is, what I'm learning about myself, and the steps that they put in place for me to prep my body to be its best. So let's tune into that. So it's nice to see you again.
Nice to see you.
Yeah, this is exciting. I think, you know, working with Patty and Mac, but mainly Patty because I'm with Patty on a weekly basis, I've been experiencing just some ups and downs. So I wanted to check it out. Also, like, remember I told you I had the onset of those fibroids, and so
Yeah.
I've seen the physical changes of my body because of that. So yeah, I'm excited to have these labs and kind of review like where.
So when did you find out that you had fibroids?
This was in May.
Okay.
Yeah.
And did you have heavy bleeding? Is that what?
Yeah.
Is that what
Prompted it?
Yeah. And so I'm always fearful because that's also a sign of kidney issues and
Right.
stuff. So I went to the emergency room, and you know, they did the ultrasound and all the things, and they found a fibroid the size of like 1.5 centimeters, just the one.
Okay.
Just to put your mind at ease a little bit, I mean, fibroids are very common. You know, they probably told you that. You have some risk factors, some of which you can change and some of which you can't. And we'll get into this a little bit in a second when we talk about your labs. So race is there's a high propensity of fibroids in the African American population. Can't change that, just put you at higher risk. If you smoke, if you abuse alcohol, I mean, not just occasional drink, if you have chronic inflammation, if you're in your body, if you have vitamin D deficiency, which you did, so we're going to chat about that. If you have any type of dysbiosis in your reproductive tract, which is a fancy way of saying, do you have like bacterial imbalance anywhere in your reproductive tract? And so we might need to go back to that and say, okay, like what are the risk factors that we can control, knowing that we can't control all of them, and just do the best we can to make sure that fibroid stays really small, or even maybe goes away and then you don't have more. See my screen?
I can, yeah.
Okay, cool. So there was some good news in here. So if you recall, there were some signs of some inflammation that you had when we first checked your labs. And that was shown in a couple places. One is right here. It's called C-reactive protein. And it was higher than it should be for someone young and healthy like you are. But look how much it went down. So it went from 2.07 down to 0.24, which is perfect, beautiful. So that completely normalized.
Is that, remember how you said that there, like I had that sensitivity to eggs?
Yes.
Is that, would that show up there?
Yes.
I don't remember when we had that conversation, but up until probably just two or 3 weeks ago, I had my first egg. I've probably had it 3 times, you know, since because of that, because my high sensitivity.
Okay.
So maybe that's what's showing up.
There's some dot connecting that I'm going to do in a moment, because all of this makes sense and everything's related to everything else. I mean, that's what makes this so cool. But here's another inflammatory marker that got better. This one's called homocysteine. It was out of range before, and now that has come down. I'd still like it to be lower, but it's trending in the right direction. So again, that means less inflammation in your body. And here's another one. It's called sedimentation rate. It wasn't technically out of range, but it's higher than I like to see it for what's optimal. Completely cut that in half, went from 18 down to 9. So your body is much less inflamed. And I was very happy to see that. Now, what led to that? Probably the fact that you got eggs out of your body, because we saw that was causing quite a bit of inflammation for you. The thing that I want to focus on, that I think there's still an opportunity, is your vitamin D. So it was low here at 26. It went up to 31, but it's not good enough. For someone that now we know has uterine fibroids, vitamin D deficiency is one of the known connections and big influencers over who's going to get fibroids and who doesn't. So I'd like to get your vitamin D up around more like 40 to 50. But this is a good opportunity for you because vitamin D is also related to your hormones. And fibroids have a lot of causes. You know, we used to think it was solely just a hormone thing, and that's part of it. But there is so many other things as well.
Yeah.
That being said, getting your vitamin D up is going to give you better hormonal imbalance overall. So vitamin D is a great opportunity for you to help a lot of things. So it's vitamin D for sure. The egg thing, you know, I'm very proud of you for keeping it out as long as you did. I know that's hard.
It is.
Putting it back in, did you notice anything one way or the other? And you might not have, but
Yeah, I tried to pay attention, and you know, it's weird because I'm like looking for my body to have reacted to this one specific thing, but I know like fatigue can be a result of numerous things. So the day of, I was like paying close attention. I didn't feel anything, but about 2-3 days later, I experienced some extreme levels of fatigue. Like my body felt tired, but I do think that it did have like a physical effect on me for sure.
and that's actually a great point, is that these are food sensitivities, which are different than allergies. Allergies, you pretty much feel a food effect right away. Like you're immediately going to get hives, you know, your throat's going to swell up, you need an EpiPen, that kind of thing. Sensitivities are more delayed, and it's not uncommon at all for people to go hours, if not days, after food exposure to actually feel the symptom. So the fact that you think it was maybe 2 to 3 days later totally tracks with the way food sensitivities operate. So, you know, for now, I would say we got to listen to your body. Given what we're noticing, given the improvement that we saw in the inflammation in your body, which is fantastic, I think it's best to probably avoid them as much as you can.
Okay, so generally speaking, I know we have to go. Generally speaking, where would you say, like, you know, where my body is at with all the things that we've tested previously and now, as it refers as it pertains to just general health, and then as it pertains to like my woman's health and the potential for pregnancy?
Yeah, I think in general, I'm happy with where you are. You should feel good about where you are. I think that the vulnerabilities that we found, you've already started to correct. We've done a great job, or you've done a great job of tamping down the inflammation that we initially identified back in April. I'm not worried at all about this little teeny fibroid. And we have a game plan now to make sure that it stays nice and teeny and even goes away. But overall, I think you're in good shape because not a whole lot of other stuff popped up on that initial screening. You know, you were actually really healthy. There was just a few areas of opportunity for you and that you've already started correcting.
Okay.
So I'm really happy with where you are. I think you're in a good place.
Okay, that's reassuring. I know, like I've told you before, or I've expressed, like with the kidney issue and then with not having a period for so long, and I didn't know what that meant for my future. And so, yeah, this has been awesome.
Great. Yeah, I'm happy to help and continue the conversation.
Okay, great. Thank you so much, Lynn. I really appreciate it.
Alrighty. Bye-bye.
All right, bye. I hope this video was super informational. Like, this is such an important aspect of my life, is prepping myself for motherhood. I'm not saying that's happening anytime soon, but I really just want to make sure that I'm informed. I think the moral of this video is, if you do want to get pregnant, if you can, because we know it doesn't happen like that in majority of the cases, but if you can, plan the pregnancy. And then for my CKD patients, prioritize planning your pregnancy for you and your baby. It's just the best viable option to have a healthy life for you, to secure that graft and that transplant that you worked hard to get, that you waited so long for, and to give your baby the best possibility to have a wonderful, healthy life and endure none of the things that maybe you had to endure. So if you can, I know life happens and things don't always happen the way we plan, but for us as kidney disease patients, I'm always advocating for quality of life. And when it comes to being a mother, what gives us the best quality of life is planning that pregnancy. Thank you guys so much for watching. I hope you enjoyed this video. Please remember to leave any questions or comments below. I love when you guys engage. I think this is one of the most important videos to me that I've ever posted. So I hope you guys enjoy it, and I hope you guys come see me again soon, and I'll see you in my next video. Bye.